Here we go. Okay. So chapters 37 through whatever, 40 maybe, 39, 40. Okay, so this is drug therapy for peptic ulcers and hyper acidity. Again, this is only what she mentioned during class today during the review. Okay, I didn't make any videos before because no one's going to watch those. They just want the review, so that's fine. Again, this will be being turned into a podcast. And I think I forgot to mention something. I don't know. Again, 1.5 times speed, everybody. We're going to go right through this. So skip, skip, skip. Histamine 2 receptor agonist. She did not say anything about Tagamet or Zantac, which is weird. So maybe talk to her about that if you have concerns. I probably will. If I do and I get an update, I will bring it back and let you guys know in the group chat. Okay, so proton pump inhibitors. So Prevacid, Prilosec. So Omeprazole is Prilosec. It's a proton pump inhibitor. We need to know the expected action. Binds irreversibly to the gastric proton pump to prevent the pumping or release of gastric acid from parietal cells into the stomach lumen, thereby blocking the final step of acid production. So again, binds irreversibly to gastric proton pump to prevent the pumping or release of gastric acid from parietal cells into the stomach lumen, thereby blocking the final step of acid production. Adverse side effects. Well, we got a little skeleton up here. So, bone fracture. Long-term use causes osteoporosis. It's in blue because that word specifically was mentioned, but I did not see it anywhere on the slide. So, again, bone fracture, osteoporosis from Omeprazole or Prilosec or Prevacid, which are proton pump inhibitors, and they bind irreversibly to the gastric proton pump to prevent the pumping or release of gastric acid from parietal cells into the stomach lumen, thereby blocking the final step of acid production. All right, next. Prostaglandin E analog, so misoprostol or Cytotec. So misoprostol or Cytotec, you do not take this if you are pregnant, okay? Pregnancy X. That is why there is a pregnancy test up there. So, nursing considerations that you need to know is confirm that your patient is not pregnant because this medication, misoprostol or Cytotec, which is a prostaglandin E analog, causes spontaneous abortion. Now, we also need to check for GI bleeds. She specifically said check for GI bleeds, and in that, well, we know that if there's black tarry stools and abdominal pain, we probably have a GI bleed. So there you go. So misoprostol or Cytotec is a prostaglandin E inhibitor. It's a pregnancy X that causes spontaneous abortion, and you need to watch for GI bleeds, so black tarry stools and abdominal pain. Next, other drugs for peptic ulcer mucosal protectant. Sucralfate or Carafate. So sucralfate or Carafate, these are also for peptic ulcer or mucosal protectant. If you look over here, we have this nice little guy who looks like a stomach that's been shot a few times. He's got water dripping out of him. So sucralfate or Carafate protects against these holes being put in your stomach. So nursing considerations. So in class, and you guys, again, here's another one that, I'm gonna wing it. I'm gonna F it. We'll do it live here, but maybe check for some clarification. She said, meds. It's 2 hours. A meal is 2 hours before or 2 hours after you take this, right? But maybe she said antacids. So just look at this bottom thing here. So you want to take meds 2 hours before meals or antacids. They decrease effectiveness. Why is that? Well, antacids coat the stomach. So they're going to decrease the effectiveness of this drug. And then 1 hour before meals or 2 hours after. Here's the thing is that we have two different things on the slide that say meals in two different places. So I would recommend asking for clarification on this one. And then full glass of water. So by mouth 1 hour before meals or 2 hours after. And there is that. Okay, next we have antacids. Only one that we have. Only one question for calcium carbonate or Tums. That's why I wrote up here in blue. Only one question mark, and it is take with water. So she said take with water. I don't even see that on here, but that's what she said. So calcium carbonate or Tums. There's only going to be one question about it on the whole test, and it is going to be take with water. So there you go. All right, let's get into these antiemetics. So an antiemetic is don't puke. All right, and here we are with some purple highlights again, guys. For these chapters, 37 through 40, we have what are the 3 medications that you take for motion sickness? And it so happens that promethazine or promethazine is one of these medications. So phenothiazine is the class for promethazine, and you take it for motion sickness. Right there it is in purple. And we need to know the expected action for promethazine. Block dopamine from receptor sites in the brain and CTZ. All right. So block dopamine from receptor sites in the brain and CTZ. All right. Adverse side effects. This is in blue. I added this in because this is what she said in class. Seizure and neuro precautions that have to do with the adverse side effects. So for promethazine, is blurred vision, drowsiness, and confusion. Those have to do with your neuro precautions there. And then the seizure may lower seizure threshold. So whatever it is that causes seizures, there's always like in a chemical reaction, there's a threshold that you have to hit before the reaction takes off, right? And that's where your activation energy comes in, right? So a catalyst would be what lowers that activation energy to make that thing take place. This is what's going on. This is a catalyst for a seizure. It's lowering the threshold that it takes for the seizure to happen. So remember that. I know I got a little bit in depth there that I didn't need to, but it helps if you think about it. So again, block dopamine from receptor sites in the brain or CTZ. That's the expected action. Adverse side effects that have to do with seizure or neuro precautions. So neuro, blurred vision, drowsiness, confusion. Seizure may lower seizure threshold. And then we have in purple, it is one of the 3 that is used for motion sickness. And finally, it has a black box warning, respiratory depression. Again, respiratory depression. Remember that is the black box warning for promethazine. Some serious stuff, so it does have a black box warning. Here we go. Metoclopramide or Reglan. It is used for GERD, basically that fails to respond to Tums and things like that. So reflux disease. We don't really need to know any of that. What you need to know about metoclopramide or Reglan is the tardive dyskinesia. If you look up there at the top, you see the things going on with their head rotations, and I wish I could zoom in. I'm sure I can. I'll work on that. I got to quit turning away from my microphone because I know I'm screwing up this podcast version. Yeah. Anyway, so tardive dyskinesia is caused by metoclopramide or Reglan, and what that is it's like basically facial tics, and like your head turns around a lot and stuff, and you'll have some grimacing, things like that going on, and it's a lot of like if you ever see like a meth head smacking their lips or whatever. I don't mean to be mean, people have problems, but that we have a lot of people who are addicted to meth down here. It's crazy. Anyway, but they like smack their lips and twitch their eyes and jerk their heads around and stuff like that. That's what tardive dyskinesia is. So remember that. That's the one thing you have to know for this drug, okay? So prokinetic agents are metoclopramide, Reglan, tardive dyskinesia. And she said you need to know what it does. So that's what it is, basically. Okay, so scopolamine patch, which is used as number 2 for motion sickness. That's what it is. It goes behind your ear, and it's this little patch. You put it behind your ear, and it helps with motion sickness. So scopolamine, and that is your second motion sickness. That's why it's in purple. Okay, so what we needed to know are the effects that it has on the eyes. This is the only real thing besides the motion sickness that we need to know are the eyeball effects. So, blurred vision, mydriasis, and I put this in blue. I just added these things in so you know what they mean. So, blurred vision, mydriasis, which is dilation of the pupil, psychoplasia, which is paralysis of ciliary muscles of the iris, and then photophobia and increased intraocular pressure. So there's 5 different things that it does there to your eyeballs: blurred vision, mydriasis, cycloplegia, photophobia, and increased intraocular pressure. Also added in blue because it was mentioned today but not on here. If you touch this with your fingers, wash your hands and don't touch your eyeballs, because if you do, all 5 of those things, and I say 5 again because select all that applies, are in effect. And she also mentioned before that there might be a select all that apply that is literally all of them. So blurred vision, mydriasis, cycloplasia, photophobia, increased intraocular pressure for the scopolamine patch, and if you touch it with your fingers and then touch your eyes, you're going to get all of those things. Okay, next. Antihistamines, hydroxyzine or Vistaril or Atarax. Vistaril or Atarax or hydroxyzine, they're antihistamines, and we just need to know the expected use. And if I'm going to read the expected use, but if you are watching the video and you look, you're going to see some more highlighted in purple. But the expected use for hydroxyzine, which is an antihistamine, and if you think about it, why this little dude's sleepy, think about Benadryl. Pruritus, nausea and vomiting, and prevention and treating of motion sickness. So that's number 3. Anxiety, potentiation of opioids and sedation, and symptoms of alcohol withdrawal. So again, hydroxyzine, Vistaril, and Atarax is pruritus, nausea and vomiting, and preventing and treating motion sickness, anxiety, potentiation of opioids and sedation, and symptoms of alcohol withdrawal. I was actually put on Atarax, I believe it was, for anxiety, paired with benzo at one point, and this stuff will make you take desk naps. So there you go. It does work. But that is motion sickness number 3. So we're going to recap all 3 motion sickness pills or drugs really quick. Promethazine, scopolamine, which is the patch, and then hydroxyzine, this antihistamine, okay? And that is that for there. Okay, here we go. Laxatives. Psyllium or Metamucil. What do we need to know? She said, we need to know specifically what is the only bulk forming laxative that we have. Bulk forming, meaning it's going to make a big O turd, and I'm saying that grossly because you're not going to forget it. So Metamucil is our bulk forming laxative, or Psyllium, Metamucil. It's fiber. It's just a massive amount of fiber, and it's going to make you crap out of football. So there you go. Expected action, not absorbed, pulls water into the intestine, excess water stimulation, elimination, and then there you go. And I put in quotes, no R1 bulk forming laxative, but I forgot to put it in blue. I'm not following my own rules. All right, next. Dulcolax, or Bisocodyl, which is a cathartic, but I like the name Dulcolax because that's the one she uses. And we need to know what it's used for. Constipation, and is part of bowel preparation before medical examinations and surgery. Neurogenic bowel dysfunction. And then expected action is that it irritates the GI mucosa and pulls water in the bowel lumen, which increases peristalsis. I put that in blue. She mentioned increases peristalsis today in class, so there you go. There you get it. So Expected uses: constipation and as part of bowel preparation before medical examinations. I think that's the part you need to remember is before medical examinations and surgery. And then neurogenic bowel dysfunction, so Dulcolax. Another thing that it can be used for, just so you know, is and I only bring this up because it was in my case study with my group project, was my patient had a subarachnoid hemorrhage. And if you have that going on, you can't strain at all. You can't sneeze, lift anything more than an ounce, and you certainly can't strain on the toilet. So that's why they give this during neurological problems or brain surgery. So there you go. And now we are on our last one. Opiate-related anti-diarrheal agents. Um, Diphenoxylate with atropine or Lomotil. So I put low motility, Lomotil, low motility. That's the way you can remember it. Diphenoxylate with atropine, Lomotil. It's used for diarrhea. So that was one of the things we had to know. So what's it used for? Well, diarrhea. Um, Adverse side effects. We needed to know dry skin and mucous membranes, urinary retention, and respiratory depression. Okay. So I put urinary retention on there again. I think I missed it the first time. But anyway, dry skin, mucous membranes, urinary retention, respiratory depression, and then cautions, contraindications is really, and I should have put that in blue too because I added it, but don't give for virus or infection that causes diarrhea. You want to just crap out all that bad stuff. So if it's like toxic materials, any other stuff, you don't need to give this for that. It's any other type of diarrhea. So if you have a virus or you're sick, don't take this for your diarrhea. Just poop it all out and be happy about it. But we're going to give it one more rundown. Diphenoxylate with atropine or Lomotil. Low motility. It's used for diarrhea. You need to know dry skin, mucous membranes, urinary retention, respiratory depression. I see that as maybe a select all that apply right there. And then you want to crap out the bad stuff, so don't give it for some or virus or infection or that causes diarrhea. And with that, that's all there is for this group. There's one more group for this next test. And that is that. But before I go, I'll tell you guys a quick story about this stuff. So a lot of these antidiarrheals, they're actually controlled substances. They're over the counter, but there are limits. So if you go to like CVS or Walmart or anywhere to buy them, you have to, like, if you go to ring up more than X amount, the system will stop you. It won't let you do it because a lot of them, again, have an opioid in them. They have like codeine, other things like that in a very small amount to cause you to slow down and quit pooping. And when I was a manager at Walmart before I started this school. I quit on a Friday, started school on a Monday, but it was a great job and learning experience. But we had opened the online grocery stuff at the super center, and we kept getting this lady who would order like 100 boxes of this medication. We're like, what the heck is she? Like, she must have the runs. She's got the Hershey squirts, the worst of anybody I've ever heard of. Anyway, so we had to like stop the sale, and we're like, you can't buy that much. So she'd buy 10 boxes or whatever it was, and then would go and she'd put in an order for 10 more boxes at the next town up. So Raymore, I'm in Harrisonville, whatever, and all these other stores around. And that was after, and then someone else would put in an order for 10 more boxes. It was someone else's name with a different credit card. So she was racking up these amounts, but we figured out, we did some sleuthing around and figured out who this person was that was buying it. And we ended up having to ban her from all Walmart locations. Basically, like, you're 86, dude. No more pooping drugs for you. We know what you're doing. They got opioids in them. So that's a fun story. It's crazy what people do to, get their fix these days. I feel bad for her, but that's a thing that's going on now. People are just like ODing on anti-diarrheal pills because it has some mild opioids in it, and of course we have a crisis in this country. So Anyway, just something to think about if you end up somewhere and somebody comes in and is like, I've got diarrhea, and they keep coming back. I've got diarrhea. Well, that's why they're doing it. So there you go. Thanks for watching and listening.